Hello there, crackheads. This is Dr. Jeffrey Schnapp coming at you again, and I want to talk to you about today about when are x-rays necessary. There are some patients that come into my office and they expect x-rays straight away because of the experience they had or what they learned online. There are doctors who do not take x-rays, period, unless they really have to, and then some doctors who take it mandatorily. So which is which? A lot of it is dependent on their technique and how the doctor wants to observe your body. Doctors who take x-rays, in my opinion, for every patient, is part of a technique. It's not part of the fact-finding bit behind the patient. For me, for example, I like taking good history and physical. You get all your basics from there, and you get to build up rapport as well. From your history and physical, from that information, then you can gather more specific information to see whether you need to irradiate a patient. Yes, when you have x-rays, you do become irradiated. Now, it's a little bit more than what the sun will give you if you're out there more than 20 minutes, not much more, but still, if you don't need to irradiate somebody, why would you need to? So by the same token, what I also want to discuss is those doctors who do utilize x-rays for each and every patient is not a bad thing. It's just different. And it depends on how you want to approach this. You have patients who don't want to have x-rays. Patients who do. A lot of patients just really don't care. They're just there to see you and you to guide them. Find a chiropractor that you feel comfortable with. So getting back to those who do take x-rays straight away, the good part is they have a lot of information. They have a lot of visual information that they can share with you as well. They can see various misalignments. They can explain why you're feeling, say, Mrs. Smith, this is why, this is right here. I bet you have any pain right there because I can see this. And then you have some objective information from the patient saying, yeah, doc, that's exactly where it hurts. So there's a lot of good to this as well. If you're looking at it from a pathological standpoint, meaning a disease-generated standpoint, a full-body x-ray is not a good way to go about it. If there's a site of pain, the doctor should say, this is where the site of pain is, and shoot that film. For example, if a patient is having neck pain that I feel is warranted and necessary, I'm not going to do a full-body x-ray. I will do an x-ray of that specific area.
All right, well, this is perfect because I literally had icy hot and a heating pad on my neck yesterday, so I don't know what's going on, but it's killing me. Yeah.
Tell me about your activity. What had happened?
I don't know if I slept funny, and maybe that was it, because I just woke up with a sore neck.
Gotcha.
I do like to sleep with multiple pillows, so I don't know if that's it. Could be. And
Yes, you're good.
And I sleep on my front too, so I don't know if that's probably what it is, but I don't know if it's like a pinched nerve. I mean, I'm sure you'll probably be able to feel and see.
Any pain going down to the arm at all?
If specifically, like back here, I press into it, then I kind of feel that in my arm a little bit.
Sure.
But just in general, it's just sore.
That's okay.
Yeah.
Let's check it out.
Okie dokie.
Right. Have a seat first, if you would.
Okay.
I'm just going to work behind you here.
Okay.
I just want to see what this is like. You're mentioning this side here.
Yeah.
Like right in here?
Down a bit. It's kind of in there a little bit, yeah. Oh, right
there.
there.
Right off to the side. There it is. Whoa! Oh, I can feel that. And it goes all the way up here, doesn't it?
Yeah.
Yeah.
Oh, that already gave me goosebumps.
All right, sweetie. I'm going to have you on your back if you would, please.
Okie dokie.
And move down just a bit if you would. There we are. Let's get that nasty side first. Here it is. Oh my word. That was nuts right off the bat. Dang. Right there too.
Yes.
I'm also going to adjust your shoulders.
Okay.
So I'm going to have you have a seat facing in that direction, if you would.
Okie dokie.
Here we are. This one here. Like you're waving that way.
Okay.
here. All right.
Thank
Feel a bit
you.
different?
It does, yes.
Yay!
It does. Thank you so much.
Much my pleasure.
Thanks.
So I want you to remember, when you go home, never use heat with something like this.
Okay.
Because it's duly inflamed. So anything that's inflamed, you put heat onto it. What it does, it throws blood to the area, which increases the fluid volume in that specific area, which puts more pressure on the joint and all these sensitive structures that are there.
Okay.
If you put ice on it, which is going to be is my best bet, even in the wintertime, use ice. Because it's a natural anesthetic.
Yeah.
It decreases your pain threshold. It's a natural analgesic, so it also helps move the inflammation away from that area.
Okay.
So always, you can never, ever go wrong with ice, but you can always go wrong with heat.
That makes sense because after having the heat on all night, it didn't feel any
No,
better.
it just makes it worse. It just makes it.
Yeah.
It feels good while it's on there.
Yeah.
When you take it off, all that fluid is still stagnant,
Uh-huh.
and it's going to put more pressure on those sensitive structures.
Okay,
So ice
good
can be
to
your
know.
best bet. Ice is nice.
Thank you. Okay.
All right.
Thanks.
You're welcome. Arturo, I am
Yes,
Dr.
sir.
Schnapp. Pleasure to meet you, man.
Nice to meet you too.
Tell me about what's going on with you.
Alright, man. So most of it has to do like mainly just half of the right body.
Mm-hmm.
So and when I was in high school, I used to do a little bit of weight training,
Mhm.
and I did perfectly fine. And then as soon as I got introduced to like machine wise,
Mhm.
Planet Fitness, I know how to use it, and so then I kind of messed up my shoulders.
Sure.
Now it's kind of messed up.
Even while you're standing here, you can see one thing prominently. This shoulder right here is rolled forward.
Yeah, it did. Mm-hmm.
You can absolutely see it. This one's sitting just properly, but it's rolled forward and it's sitting more anterior, so you can see it's up higher and moving
Yep.
forward. So that has a lot to do with tight pectoral muscles here. Probably
Yeah.
it hurts right there, I'm sure. I'll show you a couple things to do afterward.
Okay,
But also just do a little brief assessment on your shoulder before I
That's
do
fine.
anything else.
that's fine.
All right. Right there, right on. Thanks for wearing black today. They got the
of
memo.
course. Yeah.
Let me have you sit on this side here, facing that wall if you would.
Yes, sir.
Take a look at the shoulder. So if you don't mind. I don't know if you guys can see this or not, but look at the shoulder here, man. It's rolled forward. I don't know if you can appreciate that or not, but I can appreciate it from the back. It's a little bit down this way, and this one's stationed normally. This happens with chronic problems with the shoulder. Because of the shoulder, what's called a diarthrodial joint, which means it moves in all directions, it can really be misaligned very, very quickly, and will stay in that position. Then you have the pec muscles here, they're extremely tight, that'll hold this shoulder forward because it approximates as the muscle contracts. I'm going to adjust your shoulder first before I do anything else, man.
Go for it.
All right. Let's go from here. There it is. Look at that right away. Straight away, man. I don't know if you can tell the difference. I can from the back here, just a little manipulation. Is a little more level, and it's not as rolled forward. Now let's get the rest of you, buddy.
All
I'm
right.
going to have you face down, sir.
Yes, sir.
Pelvis looks pretty good. So everything's on the right, so that means you're all right?
Yes, sir.
Literally?
Kind of.
Kind of. All right, let's do this, buddy. I'm going to have you on your side with this side up.
All right.
I tell patients, you may hear a series of clicks. Now, that's just a series of pops. And what that basically is, just to let you know, is a release of gas between the joints.
Mm-hmm.
Very similar to opening up a can of soda. Psh, there goes
Yeah.
carbon dioxide release.
Yes, sir.
As I oscillate the joints called the facet joints, it releases hydrogen and nitrogen gases. That's the pop that you hear. It's not the joints going crunch over each other.
No.
I always like to tell people that because that would scare me if that's what it was.
Yeah.
Just like so. And I've got you. Nice. Woo woo. Yeah, his eyes went boom. That's awesome. Then on the flip side. With both of us wearing black, I don't know where he starts or I begin.
You know.
Positions everything. Looks like a good picture. There we are. Again, I've got you. Just relax. Okay. And onto your back, if you would. Legs nice and straight. Perfect. Let's get on that right side mostly. Oh, wow. I went all the way up. There's that one. That was the back part of your shoulder. Relax your arms.
Right.
Now, with your neck, it's going to sound a lot louder because your ears are there.
Yeah.
Right there. Right on. Beautiful.
Wow.
Let's see what you're doing up here. Move that shoulder around too. Feel different?
Yeah, I feel a lot better.
Beautiful.
More mobility.
That's what I want to hear. When you have more mobility in a joint, then you can rehab it to its best potential.
Yeah,
All right.
feels good.
Right on, buddy.
Appreciate that very much.
My pleasure. Hey, thank you again for watching. And remember, like, comment, and subscribe. And hit the bell so you can see when our next video comes out.